So, shall we talk about the plight of healthcare workers in the country? Doctors, pharmacists, dentists, through their union, 21 days ago issued a strike notice and said, look, there are a number of things that are absolute minimums that we need to have. First of all, we need to have doctors getting their PPEs. We need to have doctors having access to medical cover and various other because doctors and clinical officers and nurses and other cadres of healthcare workers are all our frontline fighters in the fight against COVID-19. And the doctors felt that they are exposed. 7 days later, the other unions, the Kenya Union of Clinical Officers and the Nurses Union as well, they joined them and also issued a 14-day strike notice. All of them were culminating to today. 7th of December is a day that doctors, clinical officers and nurses were to commence their strike. As late as Friday, all attempts, as had been reported by the Union of Doctors, to reach a consensus or to agree on the way forward with the government had hit a snag. This is despite, the CS for Labour, Chalugui, and the PS in the Ministry of Health, Mochache, coming out to announce that, what we're going to do? We are actually releasing money to NHIF so that doctors can have access to medical care. We have instructed the KEMSA to release PPE so that doctors can have access to this. But by Friday, the doctors were still saying, come on, we still haven't had a conversation and we haven't reached an agreement. By last evening, the doctors' union then issued a statement and said, we are suspending our strike because the health committees in the National Assembly and the Senate have reached out to us and they've said there's work that they're doing. So they're going to have conversation with them on Wednesday. And so the doctors' union, through their Secretary General, Dr. Chibanzi Mwachonda, released a statement yesterday saying that they are suspending the strike notice for 14 days to allow for dialogue. And if the issues remain unresolved upon the lapse of the 14 days, the strike will commence on the 21st of December. All members are advised not to endanger their lives where there are no PPEs. We still maintain that where there are no PPEs, we are not going to endanger our lives. So what is it that happened? Now, are clinical officers still going on strike? Mm-hmm. Yeah. Yes, they're on strike this morning.
According to the chair of the Clinical Officers Union, that's happening. Mm-hmm. The strike is still on.
And the nurses?
The nurses also, the strike is still on.
All right. When we discussed this a couple of weeks ago, we said, look, if our healthcare workers actually do go on strike, we are the ones who are also exposed. If the government does not take the next 21 days seriously and actually address their issues, we are the ones who are also involved. And I was pushing for the agenda that we should all put the government on notice, that they ought to do something about fighting COVID-19. But we are joined now by the two unions. We'll be speaking to the nurses' leadership later. The Kenya Union of Clinical Officers, through their national chairman, Peterson Wachira, and the Secretary General of the Kenya Medical Practitioners Dentists Union and Dentists and Pharmacists Union is also on the line, Dr. Mwachonda Chibanzi. Good morning, gentlemen.
Good morning.
Thank you very much for joining us. I'm going to start with you, Peterson Wachira of the Kenya Union of Clinical Officers. Are you on strike as of this morning?
Yes, thank you, Eric, and thank you for having me. We are on strike as from midnight yesterday night, and the strike is going to continue for as long as our demands are outstanding. They have not been solved. We are going to be on strike.
When you say you're on strike, sir, how does this play out in the public domain? What will we see that will communicate to us that you are on strike?
So there won't be any clinic officer in any public facility in this country as of this morning. And so the services that we provide are not going to be provided, including the theaters our anesthetists usually provide anesthesia for the patients who are being operated on, including other essential services that we run, including HIV and AIDS. But let me say that we are not happy that actually there are no services that are ongoing. The reason as to why we had given a lot of time, because it has been a lot of time since May this year, is because we didn't actually want to go on a strike during this time of pandemic, But what we are saying is that we are not the ones actually on strike. It's the government on strike because we have given them enough time to be able to rectify and prioritize health, the frontline workers, but they have actually failed to do that. So we are saying we are not the ones on strike. It's the government that is on strike because we had actually two options, actually three of them. One was to go on strike. The second one was to invoke the Occupational Safety and Health Act and leave workplace, which we actually would have even done on day one of the pandemic because the working environment was unhealthy. And the third one was to continue as usual, and that will be giving a consent that we can actually lose our members when we can actually be able to prevent it. And so we took the lesser evil, which is the strike. We ground everything. We get government to very fast put its priorities in order, and then we can be able to go back and save lives. But as we speak today, you know that we have even lost an MP because of lack of something as simple as oxygen. So we cannot continue with the situation as it is, and that is why we have said, because in May, we gave a strike notice, they came out, they convened a committee, an intergovernmental, we even thrashed out the issues. They told us they were taking them to the cabinet to be able to provide solutions. That never happened. Again, in August, we called for a second strike because the first one never materialized. The same thing happened. We were called into the Ministry of Labor. They came there with a bag full of promises. Nothing has happened since. And so that is why this time we said that we are not going to actually preside over death. We are not going to allow our members to continue dying because of government neglect. And we said we actually gave 7 days demand notice before giving a strike notice of 14 days. And since then, there is no employer that has actually responded to either our strike notice or to our demand letter, and that is why for us, we actually don't have any other option apart from going on strike until our demands are addressed and addressed comprehensively.
So, Peterson, you're saying that nobody has approached you in the time since you issued this strike notice. Nobody has even said as late as of last evening or early this morning to say, come, let us reason together. Nobody has said anything to the union at this point?
The Ministry of Labor called us last week, but what I'm saying is that whatever they were doing is whatever they have done over the other two occasions when we have actually given a strike notice, trying to give us promises that we are taking your issues. The same issues we presented in May and in August. We are going to take them to authorities so that, and your employer so that they can be able to provide solutions. We have heard that song before. Nothing has come out of it since May. And so we said that we were not going there to be given promises or to negotiate. We were going there to ask for implementation of what we had already agreed on in May and in August. But from the employer, that is the Ministry of Health, from the Moi Teaching and Referral Hospital, from the 47 county governments, there is no employer that has actually reached out to us with solutions so that we can be able to suspend the strike. And that is why we are saying the government is on strike.
Peterson, if you were to hypothesize, really purely hypothesize, why do you think that this constant state of affairs remains? Why is it that you issue a strike notice, you intend and you purpose it, and yet the same narrative that the government has never changes, make promises, never fulfill? Why do you think this is so?
I think the problem is a lack of goodwill. I think we can all agree that health sector has been neglected for quite a long time. If you look at the strike notices that we have issued since devolution, which are actually more than 100, you'll see that the reason as to why we go on strike are very minor human resource management issues. You can imagine a bulk of those strikes, it's about promotions, delayed salaries. You did not pay this one on time, you paid this one on time, you discriminated against this one by giving them illegal contracts, and such simple human resource management issues. And I think to underpin the neglect in the health sector, you saw the Teacher Service Commission come out very fast and negotiate for a medical cover for teachers who are not actually frontline staff. We have been crying since March. It's now that they are rushing and telling us they are trying to mobilize so that we can get a medical cover, which I do not believe actually is the case until now, because we have our colleague who died from Nandi and left a bill of 2 million, which we are actually contributing. That is the time they are coming to tell us that they want to procure a medical cover. It is the neglect that we have had in the health sector. It has become entrenched in the system, such that even the procedures and processes that we have with the employers actually neglect the health sector. We do not take it as a critical sector, because if you look at the other critical sectors, there is a way they are treated. For example, if you look at the Judicial Service Commission, Parliamentary Service Commission, if you look at the Teacher Service Commission and the others, when they were drafting the Constitution, they realized that these are critical sectors, and they made sure that the human resources would have a commission or a body to be able to take care of the welfare of the human resource, so that you don't have service interruption. But what you're having in health sector is that health sector was taken by politicians, and it's being used for politics of control, politics of money, and such. That is the problem that you're having with health sector. And as long as we are going to continue politicizing health sector, having health sector under political entities, I can assure you the neglect will continue and service interruptions will continue, because it will be played politics with, and that I'm sure you can never see an end to that.
Peterson, your colleague from the doctors, pharmacists, and dentists union is also on the line, and this is Dr. Jibanzi Mwachonda. Dr. Mwachonda, yesterday you issued a statement saying that you've been reached out by the Senate Committee of Health and the Senate Committee and the National Assembly Committee on Health, and that's why you declare that you're suspending your strike notice for further 14 days. Before I come to you, I want to ask that question to Peterson. Peterson, are you saying that 9 of these committees has reached out to Union of Clinical Officers?
Before we issued our strike notice, we had a meeting with the Senate Health Committee, where we were all of us, including KMPDU, KNUN, all the associations that we have in Kenya and the other unions in the health sector. And we shared our experiences and the challenges that we are having in the health sector. For the Parliamentary Health Commission, for the Parliamentary Health Committee, they have not actually invited us. They have not heard from us. I know they have been sitting with KNPDU. So from the Senate Health Committee that we sat with, we have not seen a conclusion of the process or whether they engaged the employers, and they have also not come back to us. So I can affirmatively say that we have not also seen progress from that sector. We are hoping that they will be able to intervene in the meantime.
All right, so let's come then to Dr. Mwachonda. And the reason for you suspending your strike from today is because these 2 committees have reached out to you. How has that communication happened? As late as Friday, you are saying that you haven't reached any kind of meaningful negotiations with the government. So what happened between Friday and yesterday?
Thank you, Eric. I think first and foremost to say that the plight of doctors is still an issue of big concern. As we speak now, we have a very young doctor, 28-year-old doctor, who is in ICU fighting for his life, and the bill as of yesterday was 1 million. So these are issues that are still outstanding. And to answer your question, when we left Senate on Thursday and the National Assembly on Wednesday, they had put a plea and requested us to allow them more time to take charge of the process and call upon and summon the relevant government ministries and Council of Governors to come and respond to the issues and give a solution in order to avert the strike. Our response was that the decision to suspend the strike could not be made at the sittings. We have a very consultative process on how we call on call off or suspend industrial action. And yesterday, we had a 6-hour meeting from 2 p.m. to 8 p.m. to deliberate on all the issues and more so also take into consideration the request by the 2 committees of parliament. And it was after that deliberation that we decided we will go down that route for the next 14 days. So essentially what we are saying is this: the issues remain unresolved. Parliament has seen the plight of doctors and understood where we are coming from, took upon itself, and by the way, they're supposed to be on recess. They're on recess as for Friday, but decided that they will take it upon themselves to take charge and call upon the executive to come and resolve the matters with us. That is the basis. That is the basis of that decision.
What are you hoping is going to happen? Or because I'm just assuming here, and you can stop me if I'm wrong, but I'm assuming that by the time you accepted this suggestion and said, all right, let's hold on for 14 days, that there was a flicker of hope somewhere that something would be done. What are you hoping is going to transpire over these 14 days that would then cease the strike notice?
Okay. So first and foremost is that this week on Wednesday, we will appear before the Health Committee of the National Assembly, the Council of Governors, Ministry of Health, Salary and Remuneration Commission. All the universities have been summoned to this, and 2 governors, Governor Waiguru and Governor Ndiritu Murithi from Laikipia, have been summoned to appear before these committees so that we resolve the matters. On Thursday, there is a meeting at the Senate also equally, where the same players and actors have been summoned to appear and resolve these matters. That is what we anticipate this week. And so the position for us is that if these matters are not resolved within the days that we have put forth or given them consideration, then that strike will commence. And let me say also that, this government campaigned on one slogan, kusema na kutenda. Wamesema wanataka siku kidogo, tuone vile watatatua mambo. So, and we expect that watatenda. Wasipotenda, wasipotenda then there'll be no reason to, sisi pia tutatenda kivetu.
Peterson said a few minutes ago, Doctor, that he said that they heard from the Ministry of Labor and also from the Senate Committee on Health. They heard, and the same words that were spoken in October, the same words that were spoken in May, is what made them realize that, look, this is just the same things that we've heard before. We are not going it's not going to make any difference. And that's why the strike has been upheld. Are you hearing the same words, or are you thinking that this time, it could be different?
I like your question. I'll say that, you see, for me, where I sit now, as of yesterday, I have 2 invite letters that have invited both us, the union, and the other actors from the executive side of the government. Remember, Parliament is the legislature. So with that, and having had that discussion and listened to them and their plea, I will give them the benefit of doubt. So the benefit of doubt has been given to government at this point. That is where KMPDU is.
But when you listen and hear that your other colleagues who work in the same facilities that you work in, nurses are not part of this conversation, clinical officers are not part of this conversation, don't you feel that, you owe it to them to at least demand that they also be included? So you have governors who are coming into this meeting of yours, you have other actors coming into the same meeting, but you know very well, just having the doctors there and not having the clinical officers in such meetings and not having the nurses in such a meeting would not be of great benefit.
To say that the issues mostly, and I agree with my brother Peterson, we talk and we worked together and we keep working together. These issues cut across board. And even when we went to the 2 committees, we did not go only as doctors. We said that these issues are affecting all healthcare workers, because we work in the same devolved system of governance, where arrogance is the order of the day by our governors, sorry to say, and I have to say it. And equally, we are seeing some level of arrogance at the Ministry of Health. That is the reality also, where unions are deemed to be hawawatu.
Dr. I really have to interrupt you and ask this simple question, because to me what you've mentioned is of grave concern. This arrogance you speak of, how is it manifested? And then because for you to mention it is something that you've encountered on several occasions to determine that this must be this. How is it manifested?
So how it's manifested is that, remember, in each ministry you have officials that are supposed to take charge of the ministry.
Yes.
And one thing I'll say that perhaps we most don't know is that unions are constitutional. Unions operate in the space called labor, and we have employment and labor relations. But when you have officials and governors who have no understanding of employment and labor relations, then you see the arrogance, where letters, memoranda, requests for meetings are treated as hawa watu wa kelele. And I'm saying this because this has been said to us. And Peterson will agree with me that it was said in September in a meeting where a very senior government official walked into the meeting and said, kama ni hawa watu, I will not be part of this meeting, and walked away.
This is
So
very
this is
unfortunate.
how it is manifested.
We're having a conversation around the plight of healthcare workers in the country. Remember, all healthcare, well, the nurses, the clinical officers, and doctors had issued a strike notice that was all ending today, 7th of December, to go on strike because of looking at how their working conditions, demanding access to PPEs, demanding that they have at least medical care and all. The clinical officers, according to their national chairman, Peterson Washira, have started their strike. The doctors, pharmacists, and dentists have suspended and postponed their strike by a further 14 days to allow for dialogue, because they've been invited to a meeting with senators and members of the National Assembly. Dr. Mwachonda Chibanzi, Secretary General of KMPDU, is with us on the line, and Peterson Washira, who is the national chairman of the Kenya Union of Clinical Officers, is also with us on the line. As we were going into the break, Dr. Mwachonda, you were telling us that you've been invited to this meeting by the senators and the National Assembly, and that's why you'll be attending this meeting with other stakeholders in the sector. But you still say that the plight of healthcare workers has not been addressed. As you speak today, you're telling us of a young doctor, 29 years old, who is in ICU, and the medical bill has already hit 1 million shillings. As we saw a press conference that was addressed by the Cabinet Secretary for Labour and the Principal Secretary in the Ministry of Health, they said that they are releasing money to the NHIF to cater for exactly what you're asking about. And this is the insurance for healthcare workers. Are you saying that this hasn't happened, Dr. Mwachonda?
Yeah, thank you for that question. Let me clarify that it is very clear on this compensation package that was unveiled, the 6.3 billion worth, of a package. Basically, and I was involved in the initial stages of this package. This package has covered the civil servants. It has excluded the following categories of doctors in the country. One, doctors working in the county governments that were employed after the devolution of the payroll in 2014. It has excluded doctors in parastatals. It has excluded doctors in universities and teaching hospitals. And it has excluded doctors, the saddest thing being, one of these doctors that I'm telling you is an ICU, doctors who are employed, given a 6-month contract to work in isolation and treatment centers in the country. So this is a substantial number of our members that have been excluded by this cover. And that is why, to us, the government needs to do more. And that is why we insisted that even as you've rolled out this, we are at a position where you have excluded most of the doctors. It is time that the government covers all its doctors in this republic, not just a section of the doctors, and discriminate on the doctors.
Are we looking at an issue of lack of goodwill, or are we looking at an issue of lack of resources and they really don't know how to deal with this? On the top of it, from where you're sitting, what do you think the problem is? And I think this is a question for both of you. And we can start with you, Dr.
We're in a COVID-19 pandemic. we have seen the same government grapple with COVID-19 millionaires, people who schemed to steal so that they benefit themselves and expose the frontline healthcare workers. That is the reality of the government that we're also dealing with. So what essentially we are looking at is, if there's ever been a time to mobilize, and let's say that the government has tried, because I think we rolled out the economic stimulus package, we saw that thing rolled out. But at the point where we have hit a peak of the pandemic, do we still say that we have done all that we can with the resources that we had, so we have no more resources, but at the same time also show people that there are resources to do other things in the country? Because this is COVID-19, it's a public health crisis, and the people who bear the brunt of this is us as healthcare workers. That is the point in which we're saying, reallocate resources to, one, cater for your frontline healthcare workers, and two, also the public, and that way it means that you have balance. And we're not saying stop all other projects, just reallocate resources to make sure that you address this pandemic effectively.
Peterson Wachira, the national chairman of the Kenya Union of Clinical Officers. So the clinical officers are on strike this morning. You've heard from your colleague, the doctors are saying that they're giving the government the benefit of the doubt because they've been invited to this meeting. Is it possible for you to join yourselves in these meetings, or is it possible for you to reach out to the KMPDU and present your case and say, this is what we'd like you guys to discuss in the meeting, so that then you see some possibility of a joint approach in the matter of addressing the plight of healthcare workers? Because why I'm asking this is, I see here an element of divide and rule. If you don't go into this together, if only clinical officers have gone on strike and then the nurses and the doctors have suspended their strike, we are talking about, issues being addressed from different fronts, as opposed to them being addressed uniformly. Is it possible for you to join yourselves in this conversation with the doctors and the legislators?
Yeah, Eric, there is no way for us to be able to do that. If you are to appear in those meetings, it's by invite. They already know that we are on strike. We have actually done petitions to the National Assembly and to the Senate. And so if they want to intervene, then they are going to call us. But for now, we cannot actually be able to force ourselves into these meetings. And allow me to also respond to the question that had been asked maybe before this. It's not a question of resources. It has never been a question of resources. It's a question of goodwill and priority. If you look at the way we are doing things, like when we got into the second wave and people are dying, it had actually been assumed by the government until we came out as Kenya Union of Clinical Officers and said, look, we are going to kill all of us. Stop these political meetings and such. And that is why now, on realizing that it's already out in the public, then you saw them try to contain themselves. Then you can see that while you are told there are no resources for the health sector, for other government projects like the Building Bridges initiative, there is no shortage of resources and everything has to go on as planned. So I want to agree with my brother Mwachonda and say that it's a matter of priority. The government can be able to prioritize. And the things we're asking, most of them are not actually things that will require money. You already have the PPEs stocked somewhere in KEMSA. What is the problem with releasing them and sending them to every health center from a dispensary to level 6 in this country? We are asking for simple things as give a policy directive. It only takes a printer to do a policy directive and a meeting so that you can exclude the vulnerable, because 99% of the health workers that we have actually lost to COVID-19 belong to the vulnerable group, and that is those with the pre-existing diseases, those who are aged, and the pregnant. And if you look at the advisories by the World Health Organization, by the CDC, they already tell you that these are people who are actually at risk and they should be exempted. Ethiopia, Egypt, Rwanda, Australia, Brazil, many other countries actually realized this and did that from the outset. And that is why you have not seen most of the medics dying. And the people who are dying are actually teachers. If you look at issues like those on contract, some illegality is being done. By the way, let me just give you an example. And I'll give you an example of Nakuru County, because I saw the governor put out his case yesterday. And he said that they decided to employ on contract and pay a bigger pay so that they can employ more. That is referred to as discrimination in employment as per Section 5 of the Employment Act. It is actually illegal as per the Article 27 of the Constitution of Kenya. And a governor can even actually come out and put it in public that I decided to engage in discrimination in employment so that I could get numbers. And that is the baseline of the problems that we actually do have in the health sector, that we are having people who, as also Mwachonda said, do not employ, do not actually have the knowledge in employment and labor relations. And sometimes the things that they do, they actually make us very demotivated. That clinical officer on contract is working in an isolation facility. We have had some of whom have actually been admitted in the same isolation after contracting. Number one, you are not given the right PPE. Number two, you don't have a medical cover so that it can cover you once you are admitted. Number three, your risk allowance, you don't have any because you are on contract. Even those who do have a 3,000, which is not commensurate, and you're expected to use that risk allowance to be able to pay for your bills because they are not paying.
If I can ask
So
you,
if you look
Peterson, I mean, just from what you're saying, I mean, you're talking about, look, better pay, looking at risk allowances, looking at, you know, protective gear, insurance and things like that, which is obviously what is needed. Now, walk us through what would it be like if you went into a public facility and there were no clinical officers around to carry out their duties? What would be lacking? For patient X who walks into hospital, clinical officer is not there to do his or her duty. What would be missing?
So in Kenya, clinical officers man about 90% of the outpatient services. If you go into any public health facility, in the outpatient, you have a 99% chance that whoever you are going to meet there is a clinical officer. So you see the bulk of the day patients who come into the hospital, they are treated and go home. So those services will not be there. Most of the comprehensive clinics, chest clinics where we see HIV, TB and such, are also manned by clinical officers. Those are not services that we are going to be having. About 90% of the anesthetic services in theaters, those people who provide anesthesia so that you can be operated on, are actually clinical officers. Those are services that you are not going to get, plus other specialists like ophthalmology and cataract surgeons, who also about 90% are clinical officers. Those are services that we are not actually going to be to receive as from today as we go on.
Those are very many healthcare workers across the country, and that then also affects the work that's being done by the doctors who are not on strike. To the best of your knowledge, do you know whether the nurses are on strike?
Yeah, the nurses are on strike. We are in communication with the secretary and the chair, and the nurses are on strike. We are actually meeting at Uhuru Park after this, where we will be launching our lobbying. Because we will be calling on government to stop being on strike so that we can actually provide services to Kenyans. We also don't want a strike. We don't want a prolonged period where services are interrupted, because we understand the sensitivity of the moment. But then we have to make a choice between the status quo and allow our people to continue dying, or taking this bold move and ensure that the government puts its priorities in order and we can come back and now effectively be able to deliver services when we are well protected and well catered for and when we are confident. And let me just say this. I led a team of Kenyans to West Africa in 2015. I was the team leader Sierra Leone in the fight against Ebola. We came back with a report that had recommendations on how the country can be able to put in place mechanisms to avoid falling into the same trap that Sierra Leone and Liberia fell into during the Ebola time. One of them was that we told them that this group that has come back, a group of heroes and heroines, very bold, who can actually face Ebola, employ them and put them under a disaster management as the human resource, then they'll be working in other areas so that anytime you have this, you can be able to bring them together and capacity build them so that they'll be able to conduct trainings once you have such a disease in Kenya very fast. Because there are three things that will give you confidence when you are facing such a disease and such an outbreak that is very infectious and deadly. Number one is the knowledge. Have you been trained? Number two is the protective gear. Do I have the protective gear? And if I have the protective gear, have I been trained to a level that I feel I can use them well and effectively? And number three, am I covered? If I fall in, what will happen? If I die, is my family going to live the rest of their life in this destitution? Are they going to be compensated? All these things had been provided for as we went for Ebola. We had been trained. We were trained in Kenya for 1 week, and outside there we were trained for 2 weeks. Very rigorous and intensive. Number two, we had an oversupply of PPEs. We actually never thought at the time that we would actually lack them. Number three, we had a medical cover that would actually airlift me to the best and the top hospital in the world. If I was to die, my family would actually be very rich. They would have been given a lot of millions if I actually did die. And so that is what actually gave us confidence, and we said that somebody somewhere took the responsibility of ensuring that we were catered for. We gave the same information to this government. And if you have been following our prayers, especially as Kenya Union of Clinical Officers and our advisories, these are the same things we started from the first time, even before we got the first case. This is what we were telling the government. Ensure you have trained well. Ensure that the PPEs are in place. Ensure you prepare a medical cover and a compensation package in case anybody dies. So that is why I'm saying it's a matter of negligence. It's a matter of lack of priority. It's not a matter of resources.
Dr. Machonda, as you have these conversations this morning, what is the absolute bare minimum that you're ready to take, even as we continue this? What is the absolute bare minimum? Because you know what, as we see it, it would seem, if just speculating, that it could be that the committees who meet you feel, or they assume that they could have a conversation with you and then you could convince the rest to kind of wait. But are you at a bare minimum state right now where you say, look, it's either this or we retain the strike? Or is it something that you're willing to accept a little bit here and then wait for the future?
That question is very good. And let me say that I've come out really strong and said that we will not engage in suicide mission. And I meant that. And I really mean it. You see, the issues we've put forth might look very simple, but they're very complicated given the circumstances. And given the circumstances that in the same government, it's easy to look at PPEs stuck in KEMSA, but how are they stuck there? People put in money and they're looking to make profit. So, one, PPEs must be available to the doctors and other healthcare workers, clinical officers, nurses. Two, the allowances that are applicable that we negotiated and signed in 2017, the return to work formula and CBA are non-negotiable. Three, the whole issue of compensation, everyone must be compensated. Four, the issue of the NHIF insurance, medical cover, that one must be addressed. We have a serious shortage. Let the government work on a framework to employ more doctors in public service, because as we speak, those who are on the ground are strained, are drained, and it's only a matter of time before they equally just go to work like zombies and not really give their all. Five, there is the whole issue of the Health Services Commission, because what you're seeing, and COVID has exposed systems across the entire world. But in our country, you have disjointed efforts between the national and county government, and this is now has reflected for so long in the human resource for health management, and that is why there is need for the creation of a Health Services Commission that can resolve the issues. We can talk about a devolved system of governance that it is already put in place in the Constitution, but is it working for the country as we speak? So it's a matter, and it's that point where now everyone has to now put aside their egos and say, okay, fine, there's a problem here and we must address this problem. So essentially, what I'm saying is, most of the issues, the issue of dedicated healthcare facility in each county, matters that we raised as early back as March, April, and July even reminded them in the extraordinary summit. This is not rocket science. These are things that are very doable. The issue of contractual employment, as my colleague has said, and that's why I said employment and labor relations. The capital-labor relation is always in a way that labor is disenfranchised. So the issue of giving contracts is very deliberate to simply try and disenfranchise workers. So you're not giving in this context, let me look at UHC. So you want UHC, and the pillar of UHC is to have a well-trained, efficient, and motivated healthcare workforce. Mm-hmm. But you issue contracts and give doctors, nurses, clinical officers under UHC inferior terms to those who are already in employment, and want them and push them to work as hard as the others already in employment. That works against UHC. And let me say also this that very clearly. I don't know who's advising on this UHC agenda, especially on human resources for health. But if this is the advice that will continue being given, then you will sabotage UHC. That is the reality that we must face. And I think it has come out clearly, a very good case definition is the doctors, nurses, clinical officers who are currently manning the isolation and treatment centers repurposed for UHC to work in UHC in isolation and treatment centers, and they have no form of cover. They are being paid inferior salaries. They have worked for 5 months with no pay. That is how you will kill that UHC agenda.
It's not lost on all of us also that there were 21 days, right, that were given in terms of a notice. And then these talks or these, maybe consensus building fora now have been introduced literally a day to the day when tools would be downed. Do you see that could be, that they had all this time to get in touch, but nothing was done until literally the last minute? Does that send any kind of a message to you?
I'll say this. I think when we issued the strike notices, when for the first time you are seeing a lot of effort and frantic efforts to try and engage us and talk to us, and we put forth the demands. We've been to the Senate Health Committee thrice before this, and I think the message that was sent last week was that the actors, Council of Governors, Ministry of Health, SRC, boycotted that meeting. That was a signal. They have a chance to redeem themselves this week. If they go down that route again, and come the following week and time has lapsed, I can assure you, let everyone suffer if that is what it will take for people who are in authority to take these issues seriously.
When the two parliamentary committees were reaching out to you, the National Assembly and the Senate Committee, was there any sort of an explanation as to why they were coming to you at this late in the day? 21 days down the road and they hadn't spoken to you, and now is when they're saying, we're going to have a sitting on Wednesday and Thursday. Why not last week, Wednesday or Thursday?
Let me clarify that for the National Assembly Health Committee, they called us 3 days after we issued the strike notice.
Okay.
That was the first meeting on 18th, if I remember correctly. Yes, it was on 18th. We went back to the National Assembly Health Committee on 25th, and what equally happened is that the committee made recommendations. Those recommendations were adopted by the entire National Assembly the other week on 2nd of December. So this is now a parliamentary decision that gave orders on what needs to be done. So we are at a point where the entire National Assembly has actually adopted these recommendations. And the recommendations are to basically sort out all these matters. But the recommendations are supposed to be implemented by those who are in the executive. And by executive, I mean the ministry. I mean also the Council of Governors, which is the executive arm of the county government. Mm-hmm. So they're supposed to come on board now and implement these orders that were given. The Senate Health Committee, Senate being the custodian of devolution, came in late, and they agreed. And this I'll really cite what Senator Lekina said, that they had come in late and they understood that, but they were requesting that we allow them to take charge of the process. And let me also say this very clearly. if the two houses will engage in politics with us, we are not interested in politics. If they will take this process politically, then what happens next will not be on the doctors. It will be on the same people.
We want to thank you very much for joining us this morning. And this is Dr. Mwachonda Chibanzi, the Secretary General of KMPDU and the National Chairman of the Union of Clinical Officers, Peter Somashira. Asante sana for speaking to us this morning.
Thank you, thanks a lot, and a very good conversation. I hope they will be able to listen.
We hope so too.
Thank you so very much.
This is the Situation Room, the only way to start your day.
Boaz Onchari is the chairman of the Kenya National Union of Nurses Nairobi branch, and he joins us on the line now. Boaz, good morning.
Good morning to you.
Thank you very much for speaking to us, and welcome to the Situation Room.
Well, thank you and welcome.
We heard it intimated by your colleague of the Clinical Officers Union, but
Yes.
we want to hear it straight from you. Are nurses on strike, Boaz?
I can confirm that nurses nationwide started their strike today at 12 midnight. And yes, the strike has kicked off.
So this is at the culmination of the 14-day strike notice. Just tell us, between the time you issued your strike notice and today, what kind of talk and conversations have you had with your employer?
Since we issued a 14-day strike notice, we have not had any engagement other than the one that we had with the Senate via Zoom. And then we gave our presentations and our demands to the government. But then, since nothing has happened, nothing has changed, they are only giving us false promises that indeed we are going to look into these issues. But all along, these are the same stories that they've been telling us. You realize that what we've been asking and what we are asking are not new things, are not something that we just wake up one day and say that these are our demands. These are issues that are really affecting us as healthcare workers. And it is time we tell the government, which is not serious, to actually come in and ensure that we as the frontline health workers are protected. When we are asking for protection so that we can offer efficient services, is that too much from a government that is supposed to take care of its citizens? In any case, the monetary aspect comes at number 3. But then the first thing that we are telling the government is protect us. We are seeing a number of healthcare workers now contracting COVID-19. They are going to isolation. Who are going to serve Kenyans in these hospitals? We are seeing nurses and other healthcare workers dying. For how long are we going to remain silent as our colleagues succumb to this virus? So that is why we've said enough is enough. We cannot continue to plead with a government that is not listening to us. But we better take safe than also remain at home.
So, Boaz, you're saying that you have only engaged with senators. The clinical officers say that they have engaged with the Ministry of Labor to some extent. Doctors have had engagement with the National Assembly, the senators, the Ministry of Labor and Ministry of Health officials to varying degrees. Are you saying that the only conversation that you've had since the 14 days strike notice was issued is only with the senators? You haven't heard anything from the Ministry of Health or anything from the Ministry of Labor?
You know, the issue of the Ministry of Labor, this is something that the government just likes to go and hide behind, because anytime we issue an industrial action, then they run to the Ministry of Labor saying that indeed the services that we're offering are essential. Then we let them suspend, we go for negotiations or rather reconciliatory talks. This issue of reconciliatory talks is just to trying to avert a strike that we have given the employer enough time, but then they run towards the last minute when we are about to settle our strike is when now they bring in this issue of the Ministry of Labor. Yes, at one point I know our national leaders led by our General Secretary Seth Panyako engaged with the Ministry of Labor, and you saw the kind of response they gave. What they did is, these are issues that need to be addressed, but then even the minister did not see the need of us not being protected. What he only said is, we are requesting you to continue offering services as these issues are looked into. But for how long are they going to look into these issues? Those are the same talks they have been telling us since January. Now we are in December, so we cannot buy their decision as at now.
If I may ask this question, given the length of time that
Yes.
not only have strikes been called for, but they've actually been enacted, is there any time when any of the promises that the government has made to you as a union, has there a time when they've actually been fulfilled? And if they've been fulfilled, what were these promises?
I can tell you the last time when a government when the government actually fulfilled, it is even through a strike that is when we push them to the wall and they are able to give in to a certain demand. But look at the issues we are asking for. A CBA that is supposed to be negotiated and implemented in 3 years, it is now more than 3 years. That means that CBA becomes null and void, has to be renegotiated again for it to be implemented. So I can tell you this issue. Look at the number of strikes that we've gone. We as nurses, how many strikes have we actually, or the industrial actions have we called for this year? More than 6. So you can imagine that this is an employer who wakes up, tells you that I'm going to implement this, then along the way abandons the process, then forces us again to go back to the streets. Look at what the counties are doing. They come in and give false promises based on an agreements which they don't honor. So I can tell you from where we sit, the government has failed and has failed totally. It has failed Kenyans, and they need to rethink on what they are doing.
Is there an absolute minimum that you would listen to? Because let's look at it as we speak today. Doctors who most often work hand in hand with nurses at hospital, in the majority of cases, there's a doctor and there's a nurse hand in hand. They are holding off on the strike for the next 14 days. What is the least, Boaz, that you would be able to listen to and hear if it is offered?
You know, our demands as we had put them, they remain our bare minimums, simply because the employer has not given any counter offer. So our demand still stands. We need to be protected. Look at the exposure that we have at our workplaces, and then you end up giving me a risk allowance of 3,850. If Boaz was to contract COVID today, I will have to cater for bills in any institution that I will have to go. We have seen our colleagues who have succumbed to the virus. We have a nurse in Busia who was admitted to ICU. She was in ICU for 23 days, and then after that, she succumbed. She has a bill of 2.3 million that we nurses are now coming in, chipping in so that we can offset that bill, and then she left her young family. So if the employer cannot cater for all this, a colleague has succumbed in the line of duty, you contract the virus and then you are told you are on your own, surely. So how do you want us to work if this is the kind of an environment that the employer is providing? Even if we were to be fair enough, the issue of our health, the issue of our, remember, as we interact with these patients, we still go home. So if we get these viruses and we're going back to our families, we're using public means of transport, we are engaging with mama mbogas, we will be the super spreaders. So when we are engaging the government, telling them that number one, protect us, give us the requisite equipment that are required for us to work efficiently and protect ourselves and also the clients that we are serving. The number two, ensure that we have a group life cover so that should I succumb to this, at least I have left something behind, knowing that my family will be catered for ABC. Ensure that in those institutions we have somewhere that we can access also these services, because like they say, we are not immune to this virus, and that is why you've seen of late it is like this virus has now turned to the healthcare workers. So we cannot sit and continue suffering when we know that the government is in a position to provide all that we are asking. These are not new things, and continue suffering. We cannot continue suffering. There is no right time to call for an industrial action. If our colleagues have suspended theirs for 14 days, it is well, because that is their union, that is their in-house. Each institution has its mechanisms of dealing with their own issues. What I know is that there is no hospital that can function without a nurse.
Please go ahead.
I want to tell you that even if they have suspended their strike, we, the nurses, are on strike, and there is no service that is going to. A doctor cannot serve that client alone. The clinic officers are out. We are out. Which services are going to be offered in those institutions? Remember, any client, the first person you will meet before you even see that doctor is a nurse who has to take those vitals, who has to ensure maybe there investigation required before you even meet that doctor. So if all these are not going to be done because these people are not there, then how are services going to be offered?
You know, the role and the function and the importance of healthcare workers cannot ever be overstated. It is not possible. It's not just mandatory, it's critical. However,
Yes.
I want to tone down the conversation and ask a simpler question. Do you have members who actually work for private institutions?
Yes, we have members working in private institutions.
So when you call a strike like this, how do they respond to that? Or does a strike only involve those who are in public service or in government service?
This is what happens. Our members in private institutions, remember, there is what we call a CBA. A CBA, for instance, look at MTRH and the Kenyatta. They will not be joining us in the strike simply because the employer has put in measures and has actually provided what we are demanding for. So those who are in private institutions, we normally have a CBA. Go to Kijabe Mission Hospital. They have a CBA that stipulates this is what they're supposed to get in terms of their risk allowance, in terms of their take home, the provision for the medical cover. So for those ones, they will not proceed because the employer has put in mechanisms. But look at the county government. These are the worst employers that we've ever seen.
The county governments. How so?
The county governments are, look at now they are clinging on, they want to hold health. We've been pushing for a health service commission, but you realize that the governors are the ones saying that it will undermine the fruits of devolution. They have not shown any, as in they're not in a position to tell us how they're managing this health. You've seen health is the most affected. These governors want to control the finances and everything in health, but then at the same time, they don't want to provide us with what we are demanding for. So we've been pushing for a health service commission, which was struck off the BBI. If BBI was able to get 500 signatures in less than 5 days, but you cannot produce a PPE. Yes.
Yes.
But you cannot provide a PPE to the farthest dispensary in Turkana or in Mandera.
Mr. Onchari, we feel your pain. We really do. But the question that my colleague asked was with reference to, it was a strong statement, really strong, and I believe it requires some qualification. You refer to the county governments as the worst employers. What do you mean, sir?
They are not taking our issue seriously. Look at, I think one of the governors from okay, let me not mention, but there's a governor who clearly came out and said that if you want to proceed for a strike, go. It will not help you. We will look for others and give them contracts. As if how do you take health workers that now you proceed? We'll get some who have also gone to school like you. We'll give them 3 months contract. You will do. They go. You see, now those kind of talks are what we are looking, and that is why I'm referring to these guys are the worst in terms of managing health issues in the counties.
Let's bring in the chair of the CEC's forum across all the 47 counties, and this is Dr. Andrew Mulwa. He is the county executive committee member for health in Makueni County. Dr. Mulwa, good morning.
Good morning. How are you this morning?
Very well, thank you. And asante sana for joining us right here in the Situation Room. You've heard from the chair of the National Union of Nurses, Nairobi branch, Mr. Boaz Onchari, who says, as far as they are concerned, in fact, counties are the worst employers ever. Let's just begin with your response to that. And you've heard the reasons why.
Thank you. I think to begin with, I would say that one, it cannot be true that simply because of a statement, because you qualify the statement by saying certain governor that is not mentioned says you can get people from the market. It cannot be true that we are the worst employers. And I'll begin by saying that immediately before devolution, I was working for the national government when health was in the national government. I was working in a rural community, working in a rural hospital, and I know the challenges that we used to have in the district and in the district hospital. And I have seen the transformation that counties have done in that period, and how, in terms of health system support, issues have been addressed. And I must begin by saying, when I talk about our health system, I am talking now about the whole spectrum of commodities. I'm talking about healthcare financing. I'm talking about health information systems. I'm talking about infrastructure development. I am talking about human resources for health and service delivery. And, you know, I look at it from health system support. Of course, I appreciate that the one component of this system approach that has not really appreciated the value of devolution is human resources for health, which I think is what leads us to the conversation that we're having today, that there have been industrial issues, human resource issues in devolved health with advent of devolution. And this has been caused by many reasons, which broadly speaking, I will start by saying any country that has had devolution, you can start with Mexico, you can talk about Fiji, you can talk about Indonesia, you can talk about countries that move from central system to devolved systems. They have faced the same challenges that we are facing today. It is not unique to Kenya that the human resource component for health feels disfranchised by devolution. And one of the reasons why that happens is because, one, when health is devolved and the supervision of health moves from one central organ to the counties, there is first the feeling that healthcare workers are moving to local authorities, kanjos, and that feeling alone brings anxiety amongst them. And the challenges that we face, especially in our setup, where the counties, despite being independent, are so dependent on resources coming from national government, and a lot of times there are delays in disbursement of funds, which affect how salaries are paid and such like things. Then also, we must also be cognizant of the fact that these close supervision that comes from counties being able to be close to where service delivery is happening, and therefore absenteeism and all those other things that happen with closer supervision. Also, like by themselves.
Dr. Mulwa, and I can appreciate what you're saying, but if we look at you talked about some of these things not being unique to Kenya. But one thing that does seem to be very unique in this position and where we are right now is the strike issue. It's been said over and over and over and over again. We're going to go on strike. 100 strikes in a very short period, 100 strike notices in a very short period of time. Something is not being done. Needs are not being addressed. The most recent ones that we're talking about right now are based on an agreement that was made. We heard that there was insurance that was supposed to be provided. We heard coming from the top executive in the land that this money was going to be made available. They're going on strike not because of want of what to do. They're going on strike because an agreement has not been kept and honored. How are we going to get away from this thing?
Let me speak and be honest that the issue of, like, for example, the current issues, and I want to agree there are real issues. One, the provision of PPEs, and this has been my position and will continue to be my position. Protecting healthcare workers remains a paramount responsibility of the service provider, whether private or public, and no healthcare worker should go to be exposed to infection for lack of PPE. And I keep telling the healthcare workers in Makueni now that if you feel you are not protected enough, you have no business going to the front line because it is important to protect the healthcare workers. So the issue of PPEs, and we have had conversations with the CECs, we have had conversations with the directors, we have had conversations with the unions, we have had conversations with the Council of Governors, and that is non-negotiable. For everyone who is working on the front line, they must be protected. These are basics of medical training.
But they're
if
not.
You are not safe,
Dr. Mulwa, they are not. I can understand giving an edict and saying that this is the situation and how it must be, but they are not. That's one of the reasons why they're going on strike. These things that you're saying must be provided are not being provided, and they're saying because of that we are not going to work.
I would appreciate if I got a single case of a healthcare worker who was told, get in the COVID-19 treatment unit, get into the outpatient, and you have no PPE. Where PPE is a mask, surgical, whether surgical or N95, whether if you're getting into a city, you need to have a full coverall, you have to face shield, all those things. I am not aware, and we have had this conversation with the union. And by the way, for the record, for the current strike, we have been having conversations with the unions from as far back as August this year. All the issues that are being raised, of course, they are because we are managing a complex health system with 47 counties and national government. There are issues that have been raised by the unions that are specific to some counties and not others. And there are issues that have been raised by the unions that are beyond even when you look at the issue, like, for example, the issue of the Health Service Commission. That is beyond what Dr. Mulwa can do. That is beyond what any governor can do. That is even beyond what the Ministry of Health can do. This is a constitutional issue that the legal framework currently as is provides for devolved health. And therefore, if that has to change, then it is upon now the political class, the leadership in the Senate, the leadership in the National Assembly to do constitutional amendment. That I have no control. The other issue that we have no control is the issue of the pandemic that came in this year. And being a pandemic, it cannot be covered fast as a normal illness, because that is what I think health insurance policies in this country or in the world are. And therefore, and you had NHIF say we cannot cover this, but for purposes of our healthcare workers, we have what we call comprehensive health insurance. Every county, and we had a meeting with the governors last week, and every county is either having one, because there are counties that have NHIF comprehensive cover, there are counties that have the normal NHIF plus comprehensive private insurance cover, and of all the counties, I have not had a single county that is not working towards having comprehensive health cover.
Dr. Mulwa, we will continue with this conversation. Talking about healthcare workers this morning, Adonija on Twitter has reached out and said, you know what, we're only talking about nurses, clinical officers, and doctors. We're forgetting the other healthcare workers who work in these facilities, even including the community health workers who are going around the county and the homes, taking care of the people who are in home-based care. Those also need the same thing. They need PPEs. They need to know that they are protected in case they contracted COVID-19. But let's first of all bring in Senator Ledamo Olekina of Narok County. He's a member of the Health Committee. When we were speaking with the Secretary General of the KMPDU, he told us that Senator Olekina is one of those who reached out to them and said, guys, we know we are coming to this conversation late, but please give us some time to have this conversation. Senator, good morning.
Good morning to you, Eric. How are you doing?
Very well, thank you. Welcome to the Situation Room once again.
Thank you very much, Eric, and your colleague.
Good morning.
Good morning, Senator.
Good morning. Good morning.
Senator, on the line with us is also Dr. Andrew Mulwa. He is the CEC for Makueni, in charge of health, and the chair of the CEC's Forum on Health countrywide. So let's just begin with the meeting that you want to have with the Doctors' Union. Why only the Doctors' Union? Why haven't you reached out to the clinical officers and the nurses to participate in this conversation?
Well, you see, you have got to start from somewhere. And it's rather unfortunate, and I apologize that we've kept a blind eye and not really paid attention to the issues that are affecting the health workers in this country, doctors, clinical officers, and also community health workers. Yet health is devolved. But we decided after we got information that there was an imminent strike, which was supposed to take place today, to reach out to the doctors and call them so that they can share with us their story, and we can be able to understand where they're coming from, so that we see what we can be able to assist when it comes to our role as Parliament. And just to begin, I have tremendous respect for, I think his name is Dr. The Secretary General.
Chibanzi Mwachonda.
His name, Chidanzi.
No.
Mwachonda, yeah. And
Mwachonda, just say Mwachonda, you good.
I don't know how to pronounce that name.
Okay.
And Dr. Goody, I think Goody, and there was a few other doctors who came in because they told us their story. We listened to them. And when we listened to their story, that is when we discovered that we have the ability to resolve their problems. Because some of the issues that they are raising are pertinent issues. They are raising issues to do with allowances. They are raising issues that deals with SRC in terms of the approvals of the allowances, yet they have not been paid. They are also raising issues about insurance cover for the health workers, which is something which is very important. They also raise the issue of an isolation center, which is strictly for the doctors and health workers. They also raised the issue on the need to be able to deploy more doctors so that we can be able to deal with this pandemic. Because, of course, during this period of time, in fact, even if you read the Health Act, there are certain things which have got to be done extraordinary. So these are pertinent issues that we believe we can be able to resolve them. So we decided that instead of calling the Council of Governors, they had concerns, specific concerns on specific counties. So with my experience working in the Public Accounts and Investment Committee, I know what it takes to be able to get governors to move. You invite them. If they refuse to come, you summon them. If they fail to honor the summons, you penalize each one of them 500,000 shillings. You know, and if they don't appear again, you continue penalizing them. And then also from that, you write a very damaging report that can lead to serious consequences. So these things are there, Eric. So we reached out to them, and I appreciate the fact that they listened to us. Now it is upon us to be able to ensure that we follow through, even with the Ministry of Health, you know, particularly on issues of the PPEs. And I think you can give us credit, the Senate Health Committee, because when we went to KEMSA, we told the minister, you know, you had directed these guys to release these PPEs. Put it in writing now, because these guys do not want to release them with just a word of mouth. And immediately that happened. So I think we are making some progress, and it's always good in any mediation when you've got some sort of goodwill, because then that encourages you to even be able to seek more conciliation.
But Senator, let me ask this question. Prior to the strike notice and the intent which was supposed to be actualized today, these issues pertaining to our healthcare workers had been in the public domain and have been there for some time. Are you saying that you as a Senate or the committee, you're waiting for the 11th hour to act? Why?
No. We were not waiting for the 11th hour to work. It is always good in any matter for you to exhaust all avenues which are out there. The Ministry of Health is there. You know what I feel about the money being left in the Ministry of Health instead when a function which is devolved. You know, SRC is there. There are institutions which are supposed to work. But since they have failed to perform their duty, then it is our duty now to take them to task. So it's not really a matter of waiting until the 11th hour. It's a matter of allowing and believing that when institutions are being put in place, they can be able to work. But now, since they have failed to work, we need to understand what is going on. And reasonably, so have those solutions.
Senator, also, these are not new issues, right? If we look at what
Very
we've
true.
heard from the nurses section, if we look what we've heard from clinical officers, look what we heard from doctors, these
Very
are
true.
not things that they said 21 days ago. These are things that they have been saying for years.
My dear
Sure,
sister,
the issues of COVID have come about when they talk about protective gear, but we're talking about a CBA 2017, and we're now in 2020, right? That have not been put into place. Is there some kind of guarantee?
Agree.
Is there some kind of guarantee that we are not going to take steps backwards from where we are right now?
Well, let me put it this way. Life has got no guarantees. And I think the key most important thing is to keep trying. What we have to resolve currently are the issues that can be resolved immediately. When it comes to the issue of the CBA, which is, I know it's paramount to the life of these doctors, it is something that we engage and we ensure that it is budgeted for. You know, the biggest problem we normally have is that whenever there is a CBA, then no one pushes for that money to be budgeted.
Why?
Because you've got exactly, because no one, sometimes the left hand is doing,
Okay.
the right hand doesn't
Can
know
we
what
ask
the
who's
left
supposed to
is doing.
do it then? Let me ask the question so that
It
we
is
understand and
institution.
know if we're to lay blame, who exactly the blame, on whose feet the blame
Okay.
should actually lie.
Now, let me put it this way. When it comes to issues of budgets are done by county governments, but they are advised by the CARA, which is the money we send to the county governments. But even so, the money it begins with the National Assembly and Treasury. So when they put together, the Senate doesn't have a role when it comes to the issue of the budget. It's just a matter of really, just coming into the issue of, CARA and DORA, and the division of revenue between the two levels of government. But when it comes to the nitty-gritty of the budgets, it is carried out by the National Assembly. But now, because health is devolved, it is about time now for us to look at what counties are budgeting for. Have they factored in this collective bargaining agreement, which has now been signed between the doctors and between the doctors and the county government or the Ministry of Health? So really, it's about time that we bring all these people together and then try to, call for action,
Dr. Muller, there's
And I-
something
and I believe-
I'd like to ask you. You mentioned something that seemed to respond to a question we had asked earlier. And the question was with reference to what our colleague, a representative of the nurses, had said about the nature and the status of county governments as, I am paraphrasing here, as horrible employers. Now, tell me, in your view, of course, this is not true. That one you have stated. So, what is it that, in your mind, the county governments have done that makes them good employers? With reference to the health workers, specifically.
Thank you. I think first I'll begin by saying you are talking about 47 plus 1 unit, and
Yes,
not
I am.
one. And therefore, if you did a quick analysis of each and every county, you will realize that there are many things that have happened. Like, for example, let me begin by just talking about the sheer numbers of healthcare workers that have been and that are in the county. I think prior to devolution, we have like doubled the number of healthcare workers in the establishment. That, of course, helps in terms of the service delivery, in terms of the fatigue, in terms of the number of hours that healthcare workers have to put in. We also have, and this have implemented, I think, to the last, the CBA for the doctors. Let me begin with the doctors, because we have a signed CBA with the doctors, and the counties implemented what was required. The CBAs that are pending are the CBAs for the nurses and for the clinical officers, which, like Honorable Senator has already mentioned, there are other organs of government that have to give a nod to negotiations that have happened between us, that is counties and the national government, the employer, and which is SRC and National Treasury. So we have a few issues with the nurses and the clinical officers union that are, of course, resource dependent. That if SRC is okay and National Treasury is okay, commit that they will get the resources, then those CBAs can be completed even within a day, because the body and the discussions have been ongoing for the last 3 or 4 years on the same. Then I think the issue of I talked about numbers. Where I come from, in Makueni in particular, the healthcare workers are paid in time. I must say, are paid in time. I think, except the month of August every year, where counties have challenges with disbursements from National Treasury, our salaries are paid in time. We also have give them study leaves for those who want to go and study, and we give them on full pay. We pay for school fees. We, like, for example, where I also come from, we ensure that promotions are done by merit and in time, so that healthcare workers get their promotions when they are due. In fact, we have been resolving some of the issues of healthcare workers.
So I think we've dropped you. We've dropped Dr. Mulo as he continues. So John will get him back. Senator, as we hear what Dr. Mulo is saying, what's happening around the counties and all, and the issues that you've raised, getting into CBAs not included in the budgets, and then budgets are then shared with with the assemblies, and then they're approved. Then doctors realize at the end that, okay, so what we discussed is not what we are getting. How do you intend and how do you hope to resolve this issue? You're saying that all these things, as you looked at them, are things that you can resolve and ensure that the workers can go back to work and they'll be happy. How do you intend to get that done?
You know, there are always two sides to a coin. It is important for us to listen to the reasons given by the county governments. These are the bodies as to why they are not able to implement the CBA. Then from there, we will be well informed for us to advise what needs to be done. But there's one big problem which I hope we can be able to resolve. The fact that a lot of money is left in the national government, yet health is devolved. I'll put it this way. There is an insurance policy which is being rolled out, albeit illegally, which we are going to deal seriously into it, because we've attempted to stop it from being rolled out without the procurement process being carried out by NHIF. And that is about 6.3 billion shillings worth of insurance. But it is the national government which is sending it out to civil servants and the people of NYS. Now, if more money can be found to be able to pay for those in the health sector, why can't more money be found to be able to pay, reimburse, or enumerate these doctors in the right way? So really, that is the question that we need to ask Treasury. We need to sit down with Treasury and inquire from Treasury why it is that they cannot be able to release that money, and they're releasing money for other things.
Will that question be asked, Senator? Will it be asked directly to Treasury as to answer the question? Because it's not the first time we've heard that in a lot of cases, even from the county on other matters, that the release of funds from Treasury seems to be the bottleneck as to why things cannot be done. So will this question actually be asked and an answer be shared as to this is the problem that we have? Being one, we don't have money, so this is where we are. Being two, that all right, we were prioritizing other things before this, or being three, that we just didn't get all our ducks in a row. Will the actual question be given? Because it seems that we're playing merry-go-round with this thing and we're not hitting the nail on the head.
I think you know who you're talking to. I've got nothing to hide or nothing to hold on to. If a question has got to be asked, I shall ask the question. That's number one. But I think the bigger problem we have is the issue of priorities. I wonder what could be more important than the life of a doctor.
Absolutely.
What could be more important than the welfare of a doctor who you expect to be able to take care of you, when you're not well. sometimes I just think some people, behave as if they live in another world, and they are not aware of their surroundings. So I think it's about time that we take these people to task. We demand for proper planning, because it is not that we do not have this money in this country. I can tell you this without any fear or contradiction, that if the president wants money right now to be found for a particular project, that money will be found. All he has to say, allocate the money. I'll give you a point in a very good example. Right now, we know very well that there is this scuffle between Nairobi City County and NMS. We know that Article 219 is quite sensitive when it comes to the issue of the share of revenue of our county government raised by the national government. It has to be sent to the county revenue fund without any deduction. But NMS is already carrying out projects. Where are they getting that money? Yet Sonko has not given them a penny. So the national government is giving them money. So if the president wants to find money, he will find money. Whether it is borrowing, whether it is going, tapping on money which is being held by other parastatals, he can be able to get that. And all he does, he just tells the CS Treasury, allocate 10 billion to NMS.
Senator, in the spirit of honesty and speaking forthrightly, this money that you've mentioned it more than once, because we've talked to you more than once on these matters, held within the Ministry of Health. Is it just, I'm asking purely as a layman, is it money that's supposed to go to the counties which is just sitting there and not being disbursed? Or is it money that was budgeted for but has not been released so that the Ministry of Health can do whatever it is that they're supposed to do?
You know what it is, I can tell you, is that people do not fully believe on the idioms that form follows functions, or money follows functions. If you have already devolved a function, what business do you have retaining money in the national government? Unless it is money for the level 6 hospital. So really, it is this behavior of not wanting to let go. You still want to control. We've got serious matters that we've raised even with the Ministry of Health, where when you see certain trainings are being carried out, instead of that money being sent to county government for them to carry out that training is done by the national government. This grip that you do not want to control, we have to let go. That's the only way that we are going to be able to make progress. Devolution can work if the people who are constitutionally mandated to carry certain functions are provided with money. They are provided with an enabling environment for them to be able to perform their functions. I can tell you, my biggest challenge is control. If you look at, there was a letter written by my good friend Ukuri Atani, which was about directing Sonko to release money to NMS. Ask yourself one question: who gave him that power to be able to do that? When you look at Article 287, when in terms of the 187, when the transfer of functions, when you look at 2A, it clearly states that arrangements shall be put in place for money to be sent, but it doesn't say National Treasury. It is, and then when you look at 2B, it says the constitutional responsibility shall remain in the level of government that function has been devolved to. So really, if you're going to ask me a question constitutionally, you should also have the audacity to allow me to be part and parcel of the decision of giving out the money.
And we hope that you're going to ask those questions. I want to come back to this question as we conclude the interview this morning, both to you and to Dr. Andrew Mulwa. As we speak right now, nurses and clinical officers across the country have downed their tools. That means many of the healthcare services that are provided by these two groups of people are not being provided. And we've heard even from clinical officers saying 90% of anesthetists, that means all ICU facilities around the country are not functioning. Nurses are not there to receive patients. So as we speak today, I'll start with you, Senator Olekina. You're going to have a meeting with doctors, but not with the clinical officers, but not with the nurses. Isn't it about time for you to invite the clinical officers and the nurses so that you can resolve this issue for all of them once and for all? Start with you, Senator.
Let me put it this way. We held our first meeting with the doctors. We have invited all these entities. We've invited the Ministry of Health. We've invited the Treasury. We've invited governors. We will take the opportunity to be able to raise this other question that you put out there in terms of the clinical officers and in terms of nurses. Okay. And I believe that we will be able to make progress, because as we delve into these issues of the allowances in terms of their working environment, the working environment, if a working environment for a doctor is bad, of course for the clinical officer and nurse is worse.
Yeah.
Because at least, the doctor just comes there, he goes, but the people who, carry out their vitals, who come in contact first with the patient is not the doctor. It is the clinical officers and the nurses. So really, I want to assure Kenyans that we will do our best.
Okay.
We will do our best. Let us be accused of having failed, but at least we will never be accused of not having tried. And since we know that the environment is ripe, and particularly because of the extraordinary circumstances that we are in right now, when it comes to the issue of COVID, of the pandemic, we can be able to make some headways.
Thank you very much, Senator. Dr. Mulwa, what would you like to say to the clinical officers and nurses?
First, I would like to say that, one, we have negotiations that are ongoing. Last week, I was in a meeting with PS Health and the PS Labor, under the leadership of the PS Labor, where these negotiations are ongoing with all the unions, the doctors, the clinical officers, and the nurses union. We mapped out our roadmap to ensure that we avert an industrial crisis. And I want to believe, because there is an overwhelming goodwill from the governors, from the ministry, and from everyone, that we shall be able to resolve these issues. My prayer is that we will be able to have the strike suspended today, and therefore service delivery will not be affected in the counties. There is a lot of goodwill from the government that, considering the extraordinary circumstances that we are facing in the country and as a globe, that we will be able to get an amicable solution so that the citizens of this continue enjoying the services that they should enjoy from the healthcare workers. And there is a commitment from the government side that we need to resolve these issues once and for all, because like you already mentioned, that these issues come and go around, come again, discuss the same issues. Like I was saying, there was another strike notice that had been issued sometimes in August, and the same issues that we are discussing are the same issues that we are discussing today. There was another strike notice that had been issued, I think, in February or thereabouts. They are the same issues. And in December last year, we had the same issues. And therefore, I think there is an overwhelming commitment. The governors, the Ministry of Health, the CS Health, the CS Labor, and SRC National Treasury have committed that we will have a definitive way forward on these issues so that they don't keep recurring. It's our hope that by close of business today, all the strikes will be suspended.
Thank you very much. We hope to see what happens with that. Dr. Andrew Mulwa, CEC Makueni, in charge of health and also the chair of all the health CECs countrywide. Asante sana for speaking to us. And member of the health committee in the Senate, Senator Ledamo Olekina of Narok. Asante sana for speaking to us this morning.
Thank you.
Thank you very much.
Thank you very much.
This is the Situation Room, the only way to start your day.